Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, and I offer online therapy via Skype for anxiety, for depression, for addictions, and also for working with trauma and PTSD. So if you're looking for an online therapist to help you overcome your trauma, then please reach out to me and ask any questions you may have about online therapy and the approach that I use. And feel free to schedule a session for me. The first session is a trial session where we determine if this is the right approach for you. If it is the right approach, then we typically would meet once a week for a while, maybe 3 or 4 weeks. And during this time, I will teach you how to work with your trauma, your emotional trauma, using the techniques of mindfulness therapy, which is what I specialize in. So online therapy is a good option. It's certainly very convenient. But as long as you use Skype or similar video platform, then there's no difference whatsoever between having your sessions over Skype, online, or in person. There's no difference as long as you can see each other. So the mindfulness approach that I teach basically helps you process your emotional trauma or traumatic memories more effectively. It's a very focused, strategic approach. It's quite different than conventional counseling or talk therapy. This is much more focused on the mechanism that produces trauma in the mind. So the first part of mindfulness therapy is learning to develop a balanced and non-reactive relationship with the traumatic memory. This is essential. The biggest problem in the early stages of trauma recovery is that people become identified with the traumatic memory, with the emotions that are triggered by that memory, by reactive thoughts and beliefs that are triggered by those emotions. And when we become identified with the trauma, then that basically feeds the trauma and stops it from healing and recovering, which it will do always under the right conditions and with time. So we have to stop reactivating the trauma. We have to develop a different relationship with it so that we do not become consumed by the emotional trauma every time we think about it. So that is the first part of mindfulness training. And we do this by meditating on the trauma itself. We deliberately bring it into the mind and practice developing more and more freedom from those patterns of habitual reactivity that feed the trauma. So we learn to sit with the trauma, developing more and more freedom. This is called developing equanimity, and that's a major factor in mindfulness training. You can sit with very distressing emotions or memories without becoming identified with them and without reacting to them. It just takes training. Reactive processes are habitual by nature, and we can train out of those habitual processes with a little guidance, and I will teach you how to do this. The second very important property that we develop in mindfulness therapy is compassion. So that means developing a compassionate relationship with the traumatic emotions that get triggered by the memory. The problem is usually that we try to avoid those emotions, or we get into patterns of becoming identified with them again, overwhelmed by those emotions, or we try to avoid them and through some form of distraction, or even through substance abuse. We try to get away from them, but this is the wrong approach. They will not heal if you do not develop a compassionate relationship as well as a non-reactive relationship with those emotions and memories. The third part of recovery from trauma and any other intense emotions that are associated with that trauma is to change the imagery of the memory image and also the emotions. So the traumatic memory has its particular memory imagery, and that imagery has certain properties that make it difficult to heal, to recover from. So typically, if it's very intense, if the memory imagery is very intense, then it's going to be very large in size. It's going to be very close, and it's going to be very detailed in terms of color and content. It's going to be very sharp in detail. But particularly, it's very large and very close. So that's part of its imagery, and that's what keeps the memory traumatic. It's the imagery that actually causes the trauma, not the content per se. The imagery, the qualities of that imagery are what feed the traumatic emotions. So we work on changing that imagery, the memory imagery. We work on changing it. Classically, make it smaller. That's one of the very first things we focus on. Can you make the memory image much, much smaller? And can you move it further away? These are some simple interventions that can have incredibly powerful effects on helping that memory image become less traumatic. So that's one thing. We work with those memory images. But we can also work with emotional images, that is the imagery of the emotions themselves, whether it's fear or whether it's terror or anxiety or depression or grief. All of these emotions have their own imagery that sustain those emotions. So as well as developing a non-reactive relationship and a compassionate relationship with those emotions, we also investigate their imagery and we explore changing that imagery. So when traumatic emotions heal, they do so by changing their imagery. And this happens quite naturally. For example, in the case of grief, which is one type of traumatic image, traumatic experience, the imagery changes from being very intense and very large and very close to becoming less intense, more faded, smaller in size and further away, until we can say that's a distant memory now. So that is how the mind actually processes traumatic or intense emotions. It changes their imagery. During mindfulness therapy and mindfulness meditation, we speed up this process, this natural process, by deliberately exploring how to change that imagery consciously and then finding what works. So that's another very important part of recovery from trauma, is working with the traumatic imagery and the imagery of the emotions themselves directly. We call this mindfulness-based image reprocessing, and this is a technique that I developed some years ago now and have been perfecting over the last 5 or 6 years when I've worked with people recovering from trauma and PTSD. The approach is very good. It really does produce quite remarkable changes, and people start to see benefits within 3 or 4 sessions. Once you start learning how to work with your memories and your emotions using mindfulness, you can practice these techniques at home between sessions, which then greatly accelerates the healing process. So if you'd like to learn more about online therapy for trauma recovery, then please do go to my website and send me an email, and let's schedule a Skype therapy session. I work with people all over the world who have an interest in mindfulness and its application for healing emotional suffering. So if you would like to start some sessions with me, please contact me. Thank you.